Hi, good afternoon, everyone. We have a lot of people who are still coming in from the waiting room, but good afternoon. It's good to see everyone. Happy New Year. It's great to have so many folks joining us today. And for those of you who may be new to these calls and don't know me already, I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. As always, we've got lots of updates for you today, particularly on the legislative session, which has been underway for about 3 weeks now. I think this is our fourth. We'll have the usual state and federal policy updates and everything that you need to know about the status of Kentucky's safety net programs. I know that many of you are familiar with Thrive Kentucky by now, but if we can go to the next slide, Alex. For anyone who is joining us for the first time, our mission is to meet the basic needs of every Kentuckian through systemic change, because we recognize that many of our fellow Kentuckians face historical and systemic barriers to meeting their basic needs. And for those reasons, we work together on a number of policy priorities that follow these guiding principles that you can see on the slide. And I know those are a lot of words. You probably can't read over them all now, but you will get this slide deck in the recording after today, so you can review them then. But just wanted to give you that information about our group. We can go to the next slide. If you're interested in learning more about any of the organizations that are part of Thrive Kentucky, these are hyperlinks to our organizations. And let's move on to the next slide. We would love for you all to become Thrive Kentucky sponsors. If you work for an organization that would be interested, please let us know. We typically say thank you to our sponsors here, but we are still preparing information to send out for the 2024 Thrive Kentucky year for all of our entire advocacy series, which includes our webinars, our forums with the Cabinet for Health and Family Services, and our roadshow that will be starting in May. And so we will have that information out to folks soon. But if you're interested, please let us know and we'll make sure to include you on that email. And our sponsors, of course, help us to keep all of these webinars and the in-person roadshow events free, and to provide CEUs for certified community health workers, for social workers, and to make sure that we're able to just provide a lot of good education and training throughout the year. So we appreciate all of that support and what it allows us to do. This is the agenda that we're going to be covering this afternoon during each section. If you have questions or if you have comments, we would encourage you to put those in the chat. We actually love to see, questions and comments coming in as we go, and we try to cover them as we go rather than waiting until the end of a section. So if you have anything, just add it there. We'll try to stop and get to it before we move on. And if there are things that we can't answer immediately or can't get to in the next 90 minutes, then we'll do it in the follow-up email. Before we begin, just some quick housekeeping. We have a lot of folks on the phone today, which is great. Just please be sure to mute your line so that everybody can hear. We are recording this webinar. You'll get a link to that recording along with the PowerPoint and any other materials that we discussed today. If they're shared in the chat, we'll pull all those together and put them in the follow-up email. And again, if you are a certified CHW or a social worker and you'd like to receive CEUs for attending today's webinar, please email Kelly, and Kelly will put her email address in the chat. And with that, I'm going to turn it over to Dustin actually to Dr. Schuster, excuse me, for an update on the legislative session.
Thank you very much, Emily, and good afternoon. I'm Sheila Schuster. I'm a licensed psychologist, and I run the Advocacy Action Network. I've spent a lot of years in Frankfurt, and this session, I think, is my 46th, but who's counting? Next slide, please, Alex. So just to set the context, you'll remember that we had a general election last November. And there were no changes in the governor's office or in the Secretary of State. Obviously, a change in the governor's office would have meant lots of changes in the various cabinets, departments, and divisions of state government, but that was not the case. So we have Governor Andy Beshear returning, and then Michael Adams was elected for a second term. All other statewide offices have new office holders, so that's the treasurer, the auditor, the attorney general, and the commissioner of agriculture. So this is a long session, a 60-day session from January 2nd to April 15th. And by Constitution, we have to end by midnight on April 15th. The most important thing that the legislature has to do this session is to pass a 2-year budget. And we'll talk in much more detail. I'll talk some about the budget, and then you're going to hear the budget talked about in nearly every presentation as we go along today, because those funding issues signal how important the General Assembly values the particular thing that we're talking about. There also are a number of issues that are being discussed that would go on the November ballot to possibly make changes in the state constitution. You'll remember that we've had ballot initiatives in the last couple of general elections, and we're looking possibly for 3 or 4, perhaps, issues to be there. Just a reminder that the Kentucky Senate has 38 members. Republicans hold 31 seats and Democrats 7 seats. The president is Robert Stivers from Clay County in far eastern Kentucky. And the minority leader, the Democratic leader, is Gerald Neal from Louisville. The House has 100 members, with Republicans holding 80 seats and Democrats having 20 seats. The speaker is David Osborne from Prospect in Oldham County, and the minority leader is Derek Graham from Frankfort. And one thing to remember as you go along is that once you start following a bill, that original bill number, that's HB for House Bill, whatever the number is, or SB for Senate Bill, whatever the number is, stays with that bill the entire session, no matter where it is in the process. I always tell people, if you're following House Bill 123 because it's a good mental health bill and it goes over to the Senate for consideration there, a lot of people assume it becomes Senate Bill 123, which may be about pig farming. So you really don't want to shift your advocacy and loyalty from mental health to, say, pig farming. So it stays the same no matter where it is in the process. Next, please. So let's talk a little bit about the budget. So as I mentioned, this is the given task. You know, up until 2000, the General Assembly only met every other year. And so we had to do a 2-year budget. And I think there was 1 year during COVID when they did only a 1-year budget because things were so uncertain during COVID. But typically we have a 2-year budget, and that's part of the long session. So think of the budget as a statement of our values and policy priorities. You know yourself, when you set a budget for your home or for your business, you put at the top things that you absolutely have to have, which are probably your housing, food, clothing, health access, and so forth, education for yourself or your children. And then you work down, and maybe if you have a little bit of money left, you have some fun money there at the end. So we want the legislature to put the people of Kentucky and what they and their families need to be the #1 priority in the budget. Unfortunately, we don't believe that HB 6, which is the budget that the House introduced last week, does that. And again, you're going to hear much more about that as we go along. We have more money available to spend than ever before in history. We've recovered from the recession. We've recovered in large measure, as Dustin will tell us, from the pandemic. We had tons of federal money that came in infrastructure and in the American Rescue Plan that still is available, although it's running out. The General Assembly has already put $3.7 billion aside in what we call the rainy day fund. Would be there for one-time expenses, and still has over $1 billion per year that it can spend on recurring expenses. But they continue to stockpile money away. We have, I think, 2 to 3 times as much money stashed away as is typically recommended for a budget of our size. And the reason is that the Republicans who dominate the House and the Senate want to continue lowering the state income tax. It was dropped from 6% to 5% in 2016 and is currently at 4% because they've ratcheted down by 0.5%. in the last couple of sessions, although not in this session. They want to minimize spending in order to eventually lower the income tax to zero. The problem is that lowering the income tax largely benefits the wealthiest Kentuckians and significantly decreases the funding available to meet people's needs. And we count those as education, healthcare, housing, childcare, food security, the environment, and so forth. We've heard testimony from many Kentuckians that they are experiencing rainy days now. We call that the rainy day fund, where they're socking the money away, and they need those services now. So again, you're going to hear more reference to the budget as we go along. Next, please, Alex. So a couple of bills that I'd like to draw your attention to. We've been in session. Actually, today marks the end of the third week of the session, and we've seen 417 bills introduced already. And we know that many, many more will come. The filing deadline for bills is not until February 26th for House bills and February 28th for Senate bills. The reason they set those limits is that they really need to wrap up their business by April 15th, and they can't just leave the door open for more and more bills to come. And as I mentioned, the House bill, budget bills, House Bill 6, House Bill 1 is kind of an unusual bill. It's the one-time expenditures that are designated in this budget. Here's a couple of good bills for you to take a look at, and they're both called omnibus bills, although they're quite different. House Bill 10 was introduced by Representative Kim Moser and is a bipartisan bill that addresses maternal mental health and provides resources aimed at supporting new mothers and babies with a very distinct goal of reducing health disparities. Unfortunately, in Kentucky, we have higher morbidity rates for Black and brown moms than we do for white moms. And we think part of that is the difficulty in accessing prenatal care and so forth. Over in the Senate, Senator Whitney Westerfield from Hopkinsville has introduced what I'm calling the Mammoth Omnibus Bill, because he takes an approach that not only looks at new mothers and babies, but really looks at their families and what they need to thrive. So he has all kinds of pieces in there to address what we consider social determinants of health. There's food in there, there's education, there's childcare, there's housing, there's tax credits and tax breaks. There's arrangements for people that are born that end up having developmental and intellectual disabilities. So it's a mammoth omnibus bill where he's really looking not only for the new moms and babies, but long-term as the families grow and thrive. We have several bad bills that have already been introduced that we want you to be aware of. House Bill 5 is called the Safer Kentucky Act, but many, many of us believe that it is anything but that. It really goes after crime in all forms. It creates new felonies. It increases prison terms. It reinstates 3 strikes and you're out kind of incarceration. And I think most devastating, it criminalizes homelessness. It actually outlaws sleeping on public ground or even in the car owned by an individual or a family. And while it's a misdemeanor and there's a $250 fine, think about who's homeless and who's sleeping in their car. They certainly don't have $250. And I know you'll hear more about that, particularly in the housing, the harm it can do in terms of our housing programs. Senate Bill 6 is Senator Mike Wilson, and it would remove diversity, equity, and inclusion, or what we call DEI, in colleges and universities in Kentucky. He labels those as divisive and making people feel bad. And it opens up the possibility of lawsuits against colleges and universities if people feel like they have been harmed by these DEI programs. In a similar vein, Senator Meredith has Senate Bill 93 that also bans DEI and also removes trauma-informed programs, which is something we've had since the Marshall County school shootings in 2018, to try to focus on students who have had trauma in their history, and it is interfering with their school performance. So both of those, we think, are actually going to increase divisiveness and ostracize some students, either in post-secondary or in K through 12 schools. Next, please, Alex. So we are trying to work. We first issued a General Assembly accessibility guide. I think it may be in the first year of COVID, and we have updated it. My outfit, Advocacy Action Network, working with Kentucky Voices for Health. So this is our latest version. There's a link to it. And when you get these slides, you'll be able to access it. It has gotten longer and more detailed because there continue to be more changes that we want to make you aware of. It's going to help you with just about everything from where to park to how you can more actively participate in the democratic process. So we ask you to, and I see that Kelly's put it in the chat. Thank you, Kelly. We ask you to share this, put it on your websites for people to access. And remember that your go-to website in terms of following the action in Frankfort is always www.legislature.ky.gov. That gets you in touch with your legislators, helps you identify them, helps you know who's on which committees, helps you know what the committee schedules are, and all those links are also in the accessibility guide. And next, please. So just a reminder that your voice and your vote are so critically important. We cannot have a democracy without the voice of the people. So don't get into this habit of, well, it doesn't have to be me, it's going to be somebody over here or somebody over there. I think we all have to take individual responsibility to be an active participant in this democratic process. So a really important number for you to have in your phone and at your readiness is 1-800-372-7181. That's called the legislative message line. The first time you call, it'll take you a minute and a half, maybe 2 minutes to get registered. You'll give your address and your name and your phone number. And then after that, it's about a 30-second process to call and leave a message. You can leave a message for any legislator by name, or any legislative committee, or any legislative caucus, or actually for the entire Senate or the entire House. Those calls generate what we call a green slip, and you'll go in a legislator's office and you'll see those sheets. If you're a constituent, yours will get sorted and kind of be on top because you're especially important to your senator and to your representative. Again, you could go to the legislature.ky.gov website to find your legislator. You put in your home address, and you can pull up their webpage on the website. It could give you their background in terms of what counties they represent, what civic groups they belong to, what their education is, sometimes what their religion is, and all of the legislative offices and committees that they serve on. You can email legislators at firstname.lastname@lrc.ky.gov. You can also call their office in Frankfort at 502-564-8100. You can leave a personal message, or you can call to set up a meeting. If you are a constituent, be sure to identify yourself to the staff members to say, you know, I'm Senator Jones's constituent. I live in Harlan, Kentucky, or whatever it is. We'll also remind you that we're in another election year. I know we just got rid of all the political commercials and flyers and so forth. This is for the Kentucky legislative seats and the congressional seats. The primary is May 21st with registration ending on April 16th, and the general election is November 5th. So they really streamlined this in terms of checking your registration. You can go to www.govote.ky.gov, check your registration, look up your polling locations and other election information. Again, this is a great way to be active. Research the candidates, show your support in whatever way, financially or by helping them walk the district or putting a yard sign in your yard or sending out postcards to show your support. And make sure those in your network are registered to vote. If you have somebody who you're connected with who's going to turn 18 by November 5th, they can register to vote when they're 17 and be able to vote even if they turn 18 on November 5th. And finally, I would remind you, and I think we all know this, that elections really do have consequences. So it's very important that we get out there and participate in democracy by voting. Next, please. And I can turn it over now to my friend Dustin Pugel, who's going to tell you even more what you need to know about the budget. Take it away, Dustin.
All right. Yeah, hey everyone, I'm Dustin Pugel. I'm the policy director at the Kentucky Center for Economic Policy. And we'd like to, in addition to starting with a sort of landscape of what's happening in the legislature, we also like to try and give a little background on what's happening with the economy and also a little bit of how we pay for all the things that we're going to talk about today. So let's move to the next slide. Just want to start by saying that, and if you've watched this before, you've heard me say this many times, but we are still in the midst of a really historic recovery from what was a historically bad downturn following COVID-19. I know a lot of times it feels like we're sort of trapped in a time loop or something after COVID, but we really have seen a substantial amount of jobs return. And that's good news because really the best way of ensuring economic security is securing a job that pays well. And so we're actually well above where we were prior to February of 2020 before the downturn hit. It only took us 30 months, excuse me, to get back to where we started. And we're now almost 3% above where we were in February 2020. And a lot of that, like Dr. Schuster said, is due to a lot of federal legislation, 4 rounds of relief funding passed by Congress during the downturn, and 3 rounds of new infrastructure investments since that time through the CHIPS Act, the Inflation Reduction Act, and the Bipartisan Infrastructure Law. And they're making a real difference. A lot of hiring, particularly in construction, has shot up. And so far, we're still seeing a really low number of layoffs. So economically, things are about as good as they can be, even though they're not good for everyone in all parts of the state. So let's move on to the next slide. Folks will also notice that things cost more than they used to. As we have all seen, inflation really spiked, particularly during 2022. And then pretty much all throughout 2023, we've seen prices fall back to close to pre-pandemic levels. We're still not quite there yet, but we have seen a really significant decline from the consumer price index and other measures of inflation. So while nothing is getting a lot cheaper, it's getting expensive more slowly and more normally, which also means that things like in interest rates that the Federal Reserve has increased may start coming down in future months, which may ease some of, not all, but some of the pressures around housing, which have been really ramped up because of higher inflation rates recently, again, among many other factors. So let's move on to the next slide. One thing I want to make sure that we understand, especially in the context of the budget, is that there has been an effort for several years now to cut our income tax. And the phrase that's often used is the march towards zero, which means 0% income tax. This chart is officially slightly out of date because our income tax rate was recently cut by a 0.5 percentage point from action taken last session. But we now have almost $6 billion coming in through the income tax. The income tax is still, and for now, and this is rapidly changing, our largest source of revenue. It is also better growing with the economy because wages grow faster at the top than they do at the bottom, and therefore we see a connection to economic growth mirrored in our income tax better than we see that mirrored in our sales and use taxes or other types of taxes. So let's move to the next slide. And yet there's this, like I said, a very conscious effort to reduce the income tax. Now, the legislation that set this up required that two conditions be met. The first is that our budget reserve trust fund, sometimes called our rainy day fund, has to equal or exceed 10% of the tax revenue that we bring in total. And so, in other words, we have to have about 10% savings account. The second condition that needs to be met is that the general fund receipts have to equal or exceed appropriations plus the cost of a 1 percentage point reduction in the income tax. That's about $1.2, $1.3 billion. And that's going to come into play in a big way here in a minute. But what that means is that there's a double sort of disincentive for the budget. First, there's a disincentive to spend more because that would make it more difficult to hit that second trigger. And as the income tax reduces, we have less revenue to spend to begin with. So that puts pressure on all the things we care about: healthcare, public safety, education, and so forth. So let's move on to the next slide. Just to put this into context, this is, again, actually slightly out of date. The cost of a full percentage point reduction in the income tax is closer to 1.3 billion. And just to compare that to other expenditures, Medicaid last go around cost about $2.5 billion. K through 12 base SEEK funding was about $2 billion. If you add up all of our spending on all of our public universities and community colleges, that's only about $1 billion. So, even though it seems like an income tax cut doesn't really affect the budget, when you compare the cost of that income tax cut, it is extremely expensive, and again, puts pressure on all of the other priorities that we have as a state. So let's move on to the next slide. Now, I mentioned before that second condition that has to be met to cut the income tax is that we bring in less than what we're spending plus the cost of a 1 percentage point reduction in the income tax. What that means is that the General Assembly has intentionally been underspending for the last several years. So this bar graph shows essentially how much money we had left unappropriated over the last several years. So when Dr. Schuster was saying earlier, we have money for both one-time needs through a very large budget reserve trust fund that I'm going to talk about in a minute. We also have money right now for recurring expenses, things that could go on and on and on into the future because we are spending so much less than we're bringing in, even with recent reductions in the income tax. Now, that's not going to last forever. Some of that has to do with higher inflation. So sales tax has been up, higher wages, which will probably moderate soon, and also more federal money. But still, we have a large ongoing structural surplus that we're choosing not to appropriate for very real needs. So let's move on to the next slide. Now, that money doesn't just float out in the world. That ends up in the Budget Reserve Trust Fund. And so what we've seen over the last several years is an exponentially growing Budget Reserve Trust Fund. Experts agree that the most you need to have in that is about 15%. Right now, we're at about a quarter of our general fund sitting in a Budget Reserve Trust Fund idly. Moving into next fiscal year, it could be just shy of $6 billion, which is about a third of our general fund. That's far more than we need to have, and is certainly money that we could use for things like housing, disaster response, and so forth. So there's a very real trade-off to taking the money that we are sending to Frankfurt and putting it on a shelf when we have a lot of other things out there that we need to pay for. So let's move on to the next slide. Now, there is one group of folks who benefit from an income tax cut, and that's the wealthy. So the top 20% of earners in Kentucky realize 65% of the benefit of this income tax cut. The top 1% get a fifth of it. So there's a very real benefit to very wealthy people. There's almost no benefit to poor people. In fact, the poorest million Kentuckians don't even pay income tax. So reducing the income tax rate doesn't benefit them at all. This is a really one-sided benefit. Meanwhile, we're sort of left with an austerity budgeting process on the back end. So let's move on to the next slide. So all this together has led appropriators to try and aim toward hitting the triggers. We saw that in the House budget. We're likely to see that in future changes. But again, we have many, many budget needs that need to be accounted for. One of which, and that's particularly dire, is childcare. And so with that, I'm going to let Kara talk to us about that policy.
Childcare, hooray! All right, next slide. That may have been my last childcare, hooray. Actually, we can keep it going because childcare is absolutely essential and very important. And unsurprisingly, a barrier to work. And unsurprisingly, anybody in here got any, I mean, the answer's on the slide, but it is moms who are less likely to work. And we have a situation because of that. And we know that parents are having disruptions to employment due to childcare issues. So we're preventing our workforce from working. Next slide. We also know that childcare is largely unavailable. This is a over 10-year. This is a 12-year, or I guess 11. It's just we just started 2024. Math is tough. Decline, and we're looking at, you know, the majority of Kentucky is a childcare desert, which means there are 3 children for every available slot. And we're plateaued because of that flat line at the end there is because of a federal investment that has since expired. Next slide. This is just specifically about where the childcare deserts are and how many kids are in them. You can go to the next slide. We do have the highest, which is coming up, but we do have the highest eligibility for CCAP, the Child Care Assistance Program that we've ever had. We also have currently a special population rule that allows people that work in child care centers to be eligible for CCAP, which is really wonderful. We are the only we're the only state in the country that's pulling that off right now, which is excellent news, but it still doesn't reach everyone. We still have a whole lot of parents that still need extra assistance. Go ahead. And childcare costs a lot. Now, I want to add a little caveat to this. If you've heard me anytime before ever, you've heard me say that childcare is expensive, and it should be. I would just want to reiterate that. Childcare should be expensive. We do not want there to be a room full of babies with one adult wandering around. We want there to be proper ratios. We want children to be well cared for. It really doesn't benefit us if we create child care centers where children don't get excellent care. That lands us right in the same spot where we are now, leading the country. And in case you're not looking at the video, I did that with giant air quotes because we are in first place for, dependency, neglect, and abuse in a couple of different metrics. And that leaves us in that same spot. Childcare can get us out of that spot and make our children safer, but only if it is good quality, which means it needs to be expensive. Next slide. This is the current eligibility for CCAP, which again is the highest it's ever been, and the requirements. So spread the word. Even if you thought maybe you weren't eligible, you may be again now. And that is the state median income, and those are monthly numbers. Go ahead. So the money that we had that was designated that came out of ARPA, being that, I forgot what ARPA stood for, but, federal law, that money, the sustainability payments ran out already. And next year we have more that run out. So we have to have at least $300 million a year to keep that baseline level of affordability, availability and quality we have today. And didn't anybody remember, this is like pop quiz moment. Is our current level of affordability and availability acceptable? Not a trick question. No, it is not. We do not have enough childcare. We do not have enough money going into making it more affordable for folks. So that's the minimum we need. And there is childcare in this budget, but it's not enough. You go to the next slide. And not only is it not enough, I think we can all look at this and feel a little bit embarrassed. I mean, I'm embarrassed by it, that Kentucky, with our shared money, with our shared coffers that we all pay into and are responsible for through our representative democracy, we spend $128.11 for state funding for childcare, children birth to 5, when 90% of the brain is developed. Now, I do not think that means we spend enough at any stage, right? We need more for school-age kids. We need more for higher-age kids. And like you heard from Dustin, we have it. We have more. We're just not spending it. So we need to spend a lot more on our kids. And how can we really expect different outcomes if we're not setting our babies up for success? And how do we really expect their moms to go out and get jobs and contribute and produce if they're not feeling secure in their children getting high quality childcare? Anyway, so if you want to, share this slide around, please be my guest. Next slide. And there's a couple of changes in this slide in case you're here as a repeat customer. We have new vice chairs for the House Budget Committee. Our vice chair has changed, and now we have co-vice chairs, Adam Bowling and Josh Bray. So they may not have heard from you. If you've heard this from us before, those two folks are new in that job and may not have heard from you. So please get on the phone. I hope you were taking notes during Dr. Schuster's session and wrote down everything she said to do, because here's the thing to do it on. Make the phone call and say, we need to invest our public dollars in childcare, and we need to invest a lot of them. In fact, $300 million per year is the floor for meeting what we have right now, and it needs to be more than that. And we need to increase the per pupil, the per birth to five number. So, I mean, I've thrown out we need to increase it to at least what we're spending on school age kids. And I think that is the end of childcare, because this is our explainer. I don't want anywhere to be a childcare desert, and I'm sure that nobody on this call is like, yeah, please leave my county out. Make sure that our kids don't have a place to be. We need to make sure that more centers are opened, that it's easier to open them, and that we're sending more money into our childcare industry. And I think it's just explainers, and off to Adrian Bush, Housing and Homeless Service, Homeless and Housing Coalition of Kentucky.
Hi, everyone. It's good to be with you. Next slide, please. Okay, so Dr. Schuster talked on the omnibus HB 5, and I'm going to talk about the housing and homelessness provisions contained therein. The majority of the sections included are in fact derived from the Cicero Institute, which is a group based in Austin, Texas, not Kentucky, founded by a venture capitalist. They've spent the last, 7-ish years promulgating copy and paste legislation across states with similar political conditions and dynamics between cities and state governments, such as Texas, Missouri, Georgia. To the right, you will see from the Housing Not Handcuffs campaign, a map of threats emerging across the United States. And here in Kentucky, they did take those sections and put them into the larger omnibus crime bill. And while the stated goal of the bill is to improve public safety and not explicitly to address homelessness, this bill nonetheless will impact Kentuckians who are experiencing homelessness and housing insecurity. Next slide. All right, section by section, very quickly. Section 17 bans street camping, and that includes tents, huts, temporary shelters, and most importantly, well, it's all important, but importantly, vehicles. It includes cots and beds, etc. And where would street camping be banned? Pretty much everywhere. When the area has not been designated for sleeping or camping, or the individual lacks authorization to sleep or camp in the area. All of these behaviors currently can be addressed by existing KRS in the civil penalties section, but this would move everything over into criminal penalties with a $250 fine per occurrence and up to 90 days in jail. Next slide. All right. Some of the other sections, the template legislation attempts to defund homeless assistance. The initial version would have barred any federal or state funding for permanent supportive housing programs implementing housing first components. It would have jeopardized $79 million in federal funding for homeless assistance while providing absolutely nothing in state general fund dollars. The current version does remove the word federal. It amends the requirements on behavioral health and/or substance use rehab to state that the programs must facilitate access to such services in order to receive state funding. This section is still unnecessary and grounded in misinformation about what actually causes homelessness, which is the high cost of housing. Next slide. All right, designated camping zones and enforcement. In sections 19 and 20, it would authorize local governments to create a designated camping zone, state-sanctioned homeless camp, if you will, with potable water and portable toilets, but provides no funding to do so. And here are concerns with that, namely that camping sites are expensive. We could actually shelter or even house people and get a bigger bang for our buck. Section 20 would require local governments and law enforcement to explicitly enforce the anti-homeless sections, and the Attorney General could bring suit if they did not. Next slide. Additional provisions. Section 21 expands Kentucky's stand your ground law to include people street camping as a justifiable defense for violence. And while we already have a pretty liberal interpretation, this explicitly just expands it and kind of puts it over the top. Sections 10 and 11 further criminalize residential rental damages. Since 2021, Kentucky renters can be charged criminally for damages over $1,000, which is the current felony threshold. This bill moves the threshold back to $500. The law is written and, as proposed, doesn't account for security deposits. It is in conflict with existing law in certain jurisdictions, and it further stigmatizes renters as potential criminals. Next slide. HB 18 and SB 25 bans on local discrimination bans. I want to talk briefly about housing voucher discrimination. This is when somebody has been issued a voucher from the local housing authority, a homeless service program, the Veterans Administration, different places offer housing vouchers. And the idea is to try to bridge the gap between what housing costs and what people's incomes are. Since the 1980s, we've had lots of states and countless cities adopting legislation to ban discrimination of voucher holders, including North Dakota, Oklahoma, Utah, Virginia, and then back in 2020 in Louisville. The current Louisville ordinance and proposed Lexington ordinance would not mandate landlords to accept all voucher holders. It would just require them to consider voucher holders as part of their standard screening process. And what these two bills would do is preempt local governments from enacting ordinances that ban discrimination based on source of income, in this case, housing vouchers. It effectively turns back federal money that pays rent, which frees up income for other basic needs. It has a disproportionate effect on Black and Brown Kentuckians and Kentuckians with disabilities. And finally, it undermines local control by removing a tool for housing stability proven to work in other jurisdictions. Next slide. All right. So I've talked about the bad stuff. I will talk briefly about a good bill, and that is no-cost birth certificates for homeless people, HB 100. It would amend the KRS, Kentucky Revised Statute, to establish that a homeless individual or a homeless individual under the age of 25 does not have to pay a fee to get a copy for his or her birth certificate. This is building on prior legislation from past sessions that allows youth under 25 this pathway. It uses an established regulatory framework to have providers apply on behalf of clients. And why do we champion this legislation? Because establishing identity is critical to applying for housing, school, employment, and reestablishing connections to the community. Next slide. All right, so we've got some calls to action for you. One is voting no, asking your lawmaker to vote no on HB 5, asking your lawmaker to vote no on SB 25 and HB 18, and then asking your lawmaker to vote yes on HB 100. It has passed the House State Government Committee, and so it should be awaiting a vote on the House floor. Next slide. All right, federal appropriations update. We have a little bit of a reprieve with the continuing resolution in effect through March 1st on HUD and USDA programs. And then this call to action comes from the National Low Income Housing Coalition, which is having a day of action on January 25th. You are welcome to participate or sign on at the link below. Next slide. All right, lastly, community development block grant funding for Eastern Kentucky floods still in process. The state has submitted their plan to HUD and is waiting for approval. We will be advocating with the General Assembly to get some more bridge funding for housing in the meantime. And I will turn it over to Tyler.
Thanks, Adrienne. Real quick, my name is Tyler Offerman. I work with the Kentucky Equal Justice Center on food and feeding policy. And to connect back to Kara's earlier slide, because of a lack of childcare, I have a 9-month-old crawling around this general feet area. So you might hear a scream. She might unplug my Wi-Fi. We'll see. But thanks for being here. And so just real quick to set the scene, in Kentucky, as we've already touched on, there are a lot of folks who are not able to meet their basic needs, and that shows up in empty cupboards and empty fridges across the Commonwealth. I want to stress that the numbers that we have are old. When it comes to hunger and food insecurity, the most current data we have is 2021. So all of the numbers here I would add to, because we know that with inflation and other things, there's a lot more folks that can't afford food. So, but Kentucky has always struggled. We have about, 1 in 4 kids are food insecure. We have the second highest rate of hunger, folks 50 to 59. There are large swaths of not just rural Kentucky, but large urban centers that lack basic access to grocery stores, including in Louisville. On top of that, we have a lot of counties that have what USDA, the Treasury, and other federal agencies say is persistent poverty. So that's over 20% of the population has been struggling with poverty for more than 30 years. We have 120 counties. 43 of our counties are what is considered persistently dealing with poverty. And 4 of our counties are in the top 10 nationally when it comes to food insecurity and poverty. So we got a lot of folks that are struggling. And next slide. Things have not gotten much easier. So Dustin alluded earlier to the inflation. Food prices have gone up over 20% in the last 3 to 4 years. I'm not telling y'all anything you don't know. Food costs a lot more. And on top of that, a bunch of programs, which have already been mentioned and some will be mentioned more, have gone away. So a lot of the supports that we've seen are showing up in increased prices, but also increased poverty rates. You can see this graph that shows the child poverty rate, and it pretty clearly coincides with the end of a lot of these programs and the rise in inflation. So next slide. So Congress, what are they up to? Well, it's already been alluded to, but they are what I like to call riding the struggle bus. So there have been 3. We are about to approach the 4th government shutdown fight because of an inability to reach compromise and or govern. And there is just sort of this lurching crisis, self-inflicted crisis that's happening. The next one, March 1st, is when these 3 agencies' funding will expire and all others on March 8th. We are sure hoping they can find some sense, but if they do not figure out a way to pass a full budget by April 30th, there will be across the board 1% cuts to what we are talking a lot about here is discretionary funding, non-military, but this would impact military funding as well. So it's a crisis within a crisis that they've created for themselves. And what about that farm bill? Well, these crises are meaning that the farm bill, which should have been passed last September, but got a 1-year extension, is now getting kicked down the road again. So we should have had a farm bill over 5 months ago, and it's looking like we might not have one until possibly after the election. So I know for food and farm communities, that's very concerning, but that's the update we got. So next slide. So I'm not going to go over each of these in detail. We've already touched on a couple, but some bills that impact the food system and feeding programs. The Kentucky Food Action Network is an organization, a network that me and several other folks on this call participate in. These are the bills that they have flagged. So for the good, We've already mentioned Senate Bill 34. It's big, it's impressive. We'll see where that one goes. There's also House Bill 93, the Healthy Food and Farm Innovation Fund. This would create a state fund for programs that are dealing with healthy food access to be able to draw down money so they can get more federal funds. But you might know Double Dollars, WIC Farmers Market Nutrition Program, Fresh RX for Moms. So that's a good bill. And then House Bills 189 and Senate Bill 40 have to do with getting more local food in schools. So this would create a fund to allow school districts and nutrition directors to buy more local food for their sweet little babes. So all three of those bills are good. Senate Bill 334 has 6 or 7 different food provisions, many of which connect back to some of the programs I just touched base on. But a very bad bill, House Bill 235, this would force a whole swath of people participating in SNAP food stamps to go through a increasingly bureaucratic and onerous work requirement and reporting process. One, this program, when you make it mandatory, is proven to be a failure. It does not increase people's wages. It does not help them find jobs. It really just severs them from critical food assistance while they're struggling to get their feet under them. It could impact at a minimum 80,000 Kentuckians. Oh, and it might cost hundreds of millions of dollars. So we are monitoring this. It has not moved yet, but it is very concerning and something we are watching. A couple other bills there at the bottom just to check out that we're monitoring. Next slide. All right, I just keep this slide here so everyone knows what we're talking about when we say, feeding programs. These are the big ones. And SNAP, WIC, free breakfast, free lunch, and then the Summer EBT program. And I'm excited to say that Kentucky will be participating in the Summer EBT program, and we were actually the first state in the South to allocate the funds to be able to do so going forward. So that will stay with us. One sec. Nope, she's not choking on anything. Great, next slide. All right, real quick, SNAP. A lot of folks in Kentucky utilize SNAP. As I mentioned, we have a lot of folks struggling with poverty. But as you can see, this is a map that just shows the last 20-ish years. Most folks we ever had on SNAP was during the height of the recovery from the Great Recession. We had a lot of economic recovery. You can see the pandemic there. Numbers went down and they're starting to tick back up for all the reasons I mentioned earlier. But besides the fact, SNAP feeds a lot of people. It also injects over $1 billion into Kentucky's economy, into grocery stores, and into farmers' pockets every year. I know, it's very exciting. But Kentucky actually has one of the lowest SNAP participation rates in the nation at only 65%. So a lot of the folks that are food insecure do not find a way to enroll in SNAP. So that is concerning. Next slide. And all right, sorry about that. All right, my wing woman is here to help me. So real quick, y'all might know that in SNAP pre-pandemic, there was some work reporting requirements for certain folks. Well, that went back into effect at the end of the public health emergency. This just shows you the counties that are excluded from that work reporting requirement. This changes every year, depending on economic factors, unemployment rates. So the light green are the counties that have been waived. So last year, they're still waived this year. The turquoise color shows all the new counties that for 2024 will be waived. And then the red shows the counties that are subject to this work reporting requirement. Just wanted to give you all a visual. Next slide. This is just the one pager that explains some of those, so you all get those resources. Next page. All right, real quick. A lot of folks like to talk about fraud in SNAP. Spoiler, it is not true. This is some data that shows that the total fraud rate in SNAP is infinitesimally low, about 1/4% of 1%. A big problem with fraud that we are seeing is people trying to steal people's SNAP benefits. So EBT skimming is on the rise. There's some resources that have been put out by the cabinet. The big moral here is just watch out. Change your PIN if you have a problem, contact DCBS if you think your benefits have been stolen. And it's something that we're monitoring and trying to work with the cabinet and the federal agencies to try and figure out how we can stop this from happening. But next slide. Great. And then just lastly, here's a couple quick ones. I mentioned the bills, status of Farm Bill. Here's a couple specific talking points to help support you in that work. You can find more information at the Kentucky Coalition Network's website. Next slide. And then these are just resources that will live here for you to check out when you get a chance, including the next one. And I can pass it off to Sheila.
Thank you. And I can't compete with your cute little daughter there. Next slide, please. So Medicaid has a whole lot of waivers, and it gets really confusing if you're not familiar with them, but just there are 6 waivers that are for home and community-based waivers, we call them. We also are working on a new waiver that would be a waiver for Kentuckians with a severe mental illness. A legislative task force in 2021 recommended it, and we might actually see a state plan amendment sent to the federal CMS to achieve the goal of getting supported housing and supported employment. So stay tuned on that. Another population that's previously not been served by a waiver are Kentuckians with substance use disorders who are incarcerated. Medicaid is usually suspended when somebody's in prison or jail, so they can't get Medicaid services, but this new reentry waiver is also on its way to CMS, and it would allow substance use disorder treatment to start in the jail or prison with the incarcerated individual, and then it would follow them into the community where they are much more likely to continue treatment than to begin it in the community. We're excited to end a 5-year period of working on this waiver and hope to see it move to implementation. The next are a series of waivers that have been around for 30 years or more, and we're beginning to see light at the end of that tunnel. Next, please. So these 1915C waivers are for Kentuckians with special needs. I'm sorry. We have a waiting list of over 12,000 people, many of whom have been on there for years. It's going to take between 22 and 168 years to accommodate those folks. But the one good thing in the budget, they are funding 2,550 new waiver slots over the next 2 years. Just shows you what a huge victory you can achieve if you have all the people that want something to reach out to legislators. So we had waiver participants, we had family members, we had providers and advocates who spoke up and out about this significant problem. So it really does work, folks. Advocacy really does work. Next, please. So there are some bills that have to do with behavioral health. We mentioned House Bill 10 and Senate Bill 34, both of which are really focusing on moms and babies. But Senator Westerfield put the first 2 years of funding in Senate Bill 34 for that home and community-based waiver waiting list. So it would actually fund 3,200 slots or placements, which would even be an improvement over what's in the budget. House Bills 35, 56, and Senate Bill 113 all aim at increasing the availability of licensed mental health professionals, either through changing the licensing requirements, doing a compact for social workers to be able to practice across lines, or in the case of marriage and family therapists, to be able to take a license from a contiguous state and use it in Kentucky. There is a tremendous shortage of mental health professionals, and we're really working hard to try to get as many of them into Kentucky as possible. we've talked a lot about House Bill 5. And again, the concern about negating the housing first model, which has been so successful, which puts a roof over someone's head and then works on treatment and recovery. House Bill 5 would reverse that and make people be in treatment or recovery before they got housing. It criminalizes overdose deaths, leading even to murder charges. And our concern is that what probably is going to lead to fewer bystanders calling EMS or aiding in an overdose situation. House Bill 49, as we've seen this before in other forms over in the Senate, it would allow any provider or healthcare facility or any insurer to deny any service, including a referral for services on the basis of their conscience or moral beliefs. And we have great concerns about this in terms of cutting off access to services on the basis of how somebody looks or how they're dressed or who they walk in the facility holding hands with or whatever. So anybody that is in the least bit put out by that can simply say, we're not going to serve you. And then again, I mentioned Senate Bill 6 and Senate Bill 93, removing those diversity, equity, and inclusion programs in Kentucky schools. Next, please. Just a reminder that our suicide and self-harm statistics in Kentucky are not good at all. And we've got lots of numbers here, but almost any category of people that you can think of, we've seen an increase in suicides. And probably most alarming to me as a child psychologist of many years practice are the increasing numbers of young kids, 4th and 5th graders, who aren't even cognitively aware that death is really permanent and are so upset that they do something to either attempt suicide or to take their own lives to be successful in suicide. We're concerned about increased suicides among our farmers, and there's a very helpful resource at www.raisinghopeky.com. It's an excellent program, farmer to farmer kind of supports. And then we are particularly concerned about LGBTQ youth. They are not necessarily prone to suicide because of their sexual orientation or gender identity, but because of the situations that they are placed in, especially after the passage of Senate Bill 150 last year. The Trevor Project is an excellent resource, and there's a link to it there on the slide. Next, please. So we do have a great help. The 988 Lifeline was rolled out in mid-July of 2022. And I'm very proud to say that Kentucky has done the best job of answering those calls locally because they are answered by the local community mental health centers known as the CMHCs. There's been an over 40% increase in calls since it was launched. Before, we used to give out that 10-digit national suicide prevention number, so much easier for people to remember to call 988. Most calls are answered in under 20 seconds. Less than 2% of the calls are referred to law enforcement or to ambulances. Text and chat is becoming available, I think, in some places already in Kentucky. And there's an added, you can push 2 for Veterans Line, and you can push 3 to get to the Trevor Project. So if a person is LGBTQ or that's the issue that they want to talk to somebody about, they are connected with someone who's an expert in that particular area. Next, please. Oh, hand it over to my friend Kara Stewart with non-emergency medical transportation. And I apologize.
That's right. And I promised no delay. So let's move to the next slide. Look at me, I almost delayed. So, people, tiny problem with having your phone ring to your computer, which is helpful so that I answer your phone calls, dear folks out there, so that I hear it louder, but not great for right now. Stop. So we have currently a proposed regulation for non-emergency medical transportation. I'm sure everybody on here has heard us talk enough. I recognize a lot of the names. That we want there to be changes to non-emergency medical transportation, which is a Medicaid provided benefit for the 1 in 3 Kentuckians who are currently enrolled in Medicaid if they don't have a way to get to the doctor or anything that Medicaid pays for, including pharmacy, etc., physical therapy, on and on and on, the list goes, regular therapy, Medicaid will pay for it. In fact, the government has a duty to provide that transportation. It's not particularly functional right now, which is why it's not super popular or very used very much. But this regulation, 907-003-066, look at that. Somebody tossed it into the chat already, is currently open for comment. There was a public hearing this morning to comment on this regulation. I did so. But there's still time to do it in writing until January 31st. We have a comment collector that is open that Emily Beauregard put in the chat where you can share your thoughts. I'll say that there is nothing that the regulation does that is bad. It just doesn't do enough. That's our position. So the regulation, you can go ahead. It says right here the 3 big things that it does. Which is it takes away a car to the whole household, makes it just an individual person, and it gets rid of the mechanic's note, which if you've ever been to a ThriveKY presentation, you've heard me make fun of for utterly being absurd. But it doesn't go far enough into making it actually usable and easy. You can go ahead to the next slide. So these are just links for those same things in case anybody is grabbing. We send these slides out, and this is just a reference to those links. Go ahead. Oh, I was like, yikes, forgot this slide. Nope, just came up a little more slowly. Of course, we have our kyloop.org, website for professionals, community professionals, to get connected, to know what's going on with NEMT, and we have our explainers there, and it's just a resource for anyone who's engaged in trying to help somebody else. Next slide. This is just more information. Really, the deal is just this regulation. Currently open, make comments on it. Let's push this and make it as good as possible. And then we'll see where we are and what we need to do via legislation. And I think that's it. Sure enough, Priscilla Easterling. Yup.
Thanks, Kara. Hi, everyone. I'm Priscilla. I'm the Director of Outreach and Enrollment for Kentucky Voices for Health. And today we're going to cover Medicaid renewals and special enrollment periods. Next slide, please. So we've talked about Medicaid renewals for, we're coming up on 9 months now, a little bit longer, probably a year. This time last year, we were preparing for it. So they restarted in April 2023 with the first folks losing Medicaid coverage beginning June 1. They are continuing through April 2024. The big reminders, if you know anyone who is enrolled in Medicaid, please remind them to check the mail. Everyone is getting notices. Everyone who's enrolled in Medicaid has to go through the renewal process if they have not already. So please check the mail. Do not throw away those notices. That's important information. I know we haven't had to really worry about it before now, but it matters now. So please check the mail. Make sure your contact information is up to date. If you've moved, if anything has changed in the last 3 years, even if you've changed it in the last 2 years, make sure that it's still up to date in the system. Sometimes things get copied over wrong or they get refreshed somewhere. So just to double check that your contact information is up to date and connect. And if you need any help doing that, you can always reach out to connectors. They're available in all 120 counties. They're a free resource, and they are happy to walk through this entire process from creating an application to updating contact information, reporting changes, to submitting documents as well. So please, if you know anyone who's enrolled in Medicaid, make sure that they get connected to some resources. There are great resources available on the state's unwinding page, medicaidunwinding.ky.gov. We also have our Medicaid renewal explainer that's available in English and Spanish. That's also posted on the KY Loop page. KY Policy last year put together a walkthrough of what all of this means, what it's going to look like, the action that folks need to take. And really, if you have any questions, reach out to a connector. They're more than happy to help and can walk you through all of this. Next slide, please. Okay, these are examples of some of the notices that everyone's going to receive or has received since April. For a notice of eligibility, generally, you don't have to take any action. They've either renewed your coverage or referred you to a qualified health plan, at which point you do have to sort of take action to affirmatively enroll. For an RFI, for our renewal packet, you do have to send something back to the state. For an RFI, they're asking for specific information. It's usually going to be income information. You have to submit that. If you don't, you lose your coverage. And the same for a renewal packet. It's a pre-populated form that has all of the case information on it. You just have to review it, make sure all the information is up to date, and you have to turn that back in. Again, if you don't respond to either the RFI or a renewal packet and send something back to the state, you're at risk of losing your Medicaid coverage, and we don't want that. So make sure to engage. Next slide, please. Okay, here's just an update, and all of this data comes directly from the Team Kentucky unwinding stakeholder meetings that they do. For December, they sort of redistributed cases. So for any case that they weren't able to passively process, whether that was to determine them, to approve them for continued Medicaid coverage, or to transition them to a qualified health plan, any other case that would have asked for information back from a consumer, either that RFI that I mentioned or renewal packet, those were redistributed to later in this process. So the December numbers are a bit shorter or a bit lower than the previous months, and January numbers will be much higher as well. Only 1,200 folks were terminated in December, which is a great number. Around 570 were extended. So there will be upcoming data, new updated data that comes out soon that just follows all of these different cohorts of the pending, those in that pending column, to see where they've ended up 3 months later. Were they approved? Were they terminated? And we still need to do some drilling down to figure out more about that extended population. But next slide, please. And here's the reinstatement. So there is that reinstatement period. If folks don't turn in their documents in the first, by the time that they're due, they do have another 3 months where if they, 90 days, where if they submit those documents, they can have that coverage. If they're still determined eligible, they can have coverage reinstated without having to reapply. So great numbers of folks who have been able to be reinstated and didn't have to do a full application. Next slide. Great. So if folks lose coverage, first thing to do, if you did not turn in documents, go to connect.ky.gov, update your application, turn in those documents. If the state says that you're ineligible after that, you can always ask for a reconsideration. And if they say that you're still ineligible, you can always appeal that ruling. So you have 120 days to request a fair hearing. So those are different ways. Next slide, please. Okay, like I mentioned, there are those ongoing stakeholder meetings. They're the third Thursday of each month at 11 a.m. The link is here to register. The next one will be February 15th at 11 a.m. Next slide. And that page also has great information, outreach, frequently asked questions, the slides from each month. So great resource. Next slide, please. And if you have any issues, we've talked about several issues that have popped up with document upload, document processing, folks getting confusing notices or letters. Please reach out to us if you hear any more about that. You can reach out directly to me at my email. We are tracking that and elevating those to the state directly to have them resolved. So if you have any questions, please, or know anybody who's in a weird situation, please report that up to us so that we can make sure that folks are getting covered and getting their cases fixed. Next slide, please. And this is officially the end of open enrollment and ended last Tuesday. As of the end of Tuesday, there are 75,000 members who enrolled in a qualified health plan. That's the other health insurance option that's on Connect, which is great. That's about 15,000 more than last year. So really excited about that. Next slide. And even though open enrollment is over, you can still get a qualified health plan at any time during the year if you qualify for a special enrollment period. Here's a list of some of those reasons, and we also have an explainer that's available on KY Loop, and it's right here. Most of these changes are all related to big life changes. So if you lose your coverage because you got divorced, or you get married, or affected by a natural disaster, or experiencing domestic violence or abuse, you can still qualify for a special enrollment period and get covered at any time throughout the year if you lose your coverage. All right, next slide. And connectors are a great resource to help with that. So if you need help. Perfect. I'll turn this over to Emily Beauregard.
Well, thank you, Priscilla, and thanks to all of our speakers today. I don't think we have ever gotten through that much content in record time like this. So I'm going to run through a few resources and then give you a few reminders. And I think we can get out of here a little bit early today. Why don't we go to the next slide? So we keep this section at the end of every slide deck, and we want it to be an easy place for you to go to get the majority of the information that we've shared about resources, about different events and trainings and educational sessions and so on. So one thing to make you aware of, and you might have seen this in an email from KVH if you are on our newsletter, tomorrow we are hosting a Health Literacy for the Win training in partnership with Health Literacy Kentucky. And so if you aren't already registered for that, there's still time. And there's been a ton of interest. This is a great 1-hour training for community professionals who want to talk about health literacy in their communities and with, clients, patients, that sort of thing. We also have a lot of other events that we're sharing here. Our upcoming forum with the Cabinet for Health and Family Services. There are some TAC meetings. These are the technical advisory subcommittees that advise Medicaid. And we have a number of those. They're actually, I think, 19 or 20, but I chair the Consumer Rights and Client Needs TAC. Dr. Schuster chairs the Behavioral Health TAC. We have a TAC member that we work with on the Disparity and Equity TAC. And so if you're interested in any of those are open public meetings. You can see some other links and dates here. We can go to the next slide. And the best way really to stay up to date with all of these events is to be on our newsletter. So you can see that link there as well. We have Thrive Kentucky explainers. You've heard almost every one of our speakers point to one of the explainers about a particular topic. Here is our running list of explainers. We've had all of these translated into Spanish, and we intend to continue doing that with any future explainers that we have. And so this is a great go-to, as well as just going straight to KY Loop to find these resources. We can go to the next slide. ThriveKY Coalition, their next meeting will be February 8th. If you're interested in talking with other individuals and organizations in the state who are working on improving our immunization rates and getting out good information to communities. We can go to the next slide. More resources here in terms of housing. Adrian goes over a lot of these resources on our monthly calls, but we try to keep this up to date as well. We can go to the next slide. Why don't we actually, and some utility, of course, utility assistance is really important at this time of the year, especially when we go through cold snaps like we're in right now. So there's some good information about LIHEAP, which is the Crisis Assistance Program for homeowners. And I think we can skip to the end at this point. There are a number of other resources here that you can check out when you have a minute. But what I want to do is remind you that if you would like to get CEU credit for participating today, you can complete the evaluation. You'll be getting this in the follow-up email. Also email Kelly if you have any questions or if there's any assistance that you need. And we really hope that everyone will take a few minutes to evaluate today's webinar, because it gives us good feedback so that we can make improvements for our future webinars. So everyone will get, as I mentioned at the top of the call, the recording for this call, the slide deck, the chat, any resources that we've shared, and a link to the evaluation. And with that, I think we can wrap up early today. Thank you all for being here, for your time, and we hope to see you in February, if not sooner. Bye.